Our first speaker is Justin Lessler from UNC. He's going to be talking to us about scenarios for public health. Thank you very much, Justin.
Yeah, so I'm going to be talking about evaluating scenarios in the context of public health action, and I think this is a talk that's probably heavier on the ideas than the results, but it seems appropriate for this program. You can also just think of this talk as a continuation of Emily's talk on what can we learn from evaluating scenarios projections. And all of the ideas from here are also from her, and also a lot of input from Cecile and Boot, and also none of this would be possible without the a lot of work from the scenario modeling hub teams. So I think to get everybody on the same page, I'm going to start with a clarification or specification. What is a planning scenario? What is a scenario when I say that something is a scenario? Because I think some people have very specific ideas, and when I say that, I simply mean that it's a conditional forecast. So if we think about a proper forecast, what we're really saying is we want to know the probability of some event or some probability distribution across some set of events, just period, right? And what that is like, that is a we think of that as a probability over, if we have a universe of possible future conditions, it's the probability of that event in each of those, future conditions over the probability of times the probability of those future conditions, and we integrate or add across all of that, and lo and behold, we have the probability of everything. And that's a proper forecast, just a probability event. A planning scenario, or a scenario in my mind, is just a conditional forecast, where we've conditioned on some subset of the possible futures, and we've tried to calculate the probability of the event in that subset of possible futures. Okay, so nothing completely exciting here. If we think of this visually, I kind of think that there's sort of this continuum. On the one side, we have forecasts where we try to have our conditioning capture all of the possible universes out there. On another side, we have like some, sort of theoretical modeling when we really want to understand the nature of some of the dynamical systems or possible disease systems, where we're really specifying highly specific and possibly even fantastical universes and getting very precise projections in there. And our planning scenarios or scenario projections are going to lie somewhere in between there. Kind of where they lie probably has a lot to do with where we're sitting in terms of a response or the like. So why would we want to do this? Well, I think there's a few reasons. One is that we can actually modify the future. A second is that the future possible conditions are so uncertain that if we try to do a projection across all possible future conditions, it's just a mismatch, right? It's just the probability of the future events is so uncertain as just not to be meaningful, and it's not really helping anybody do anything. Another is that what scenario wouldn't be informed by future events. Maybe we want to aid in like a conditional planning scenario, so some sort of document that says how we're going to respond to a pandemic in different ways, and so we want different future conditions specified. And the other is we might be just wanting to do science, but I'm not going to worry about that for this particular case. So I think most of what I'm going to talk about now really focuses on the modifiable, but also some on these other two bits in terms of thinking about how to do this. So we've talked about one challenge, and Emily really got in looking at evaluation and thinking about evaluation in this context, and that is that our planning scenarios are inherently counterfactual. So how can we evaluate them? Or the way I think of it is how, as scientists and people who are informing policy, how are we holding ourselves accountable to make sure we're not just, shoveling huge piles of, I'm gonna not curse, in the, out into the world, and we're actually providing stuff on policy. And Emily talked a lot about how we might go about doing that. But also, and part of what she talked about was contingent on this idea we have multiple scenarios, but also it's not really, when we go to make a decision, what somebody is looking at to make that decision in these scenario plannings, it's not necessarily the projections of each of these, it's the set of planning scenarios that we give them and their comparison, what they do, right? How they compare, how we think about them. And this is just an example of the type of grid of scenarios we would give for the scenario modeling hub, where we have some things that represent future unknowns about variance and some things that represent a decision. In this case, when do we make reformulated vaccines available? And this is actually a decision that was being made, and what we really want to evaluate to some extent is how all of these things, all of these different scenarios helped inform that decision, and whether or not that was actually a net positive or something that improved the world or accurate. So in another way of saying this is a full set of planning scenarios should be evaluated in the context of how useful it is, which brings up the question, what does it mean to be useful? And I'm going to conjecture that a predictive model is only useful if it helps us to respond to future events. That is the definition of utility, at least when we're thinking about this kind of operational modeling, which brings up another question that may seem obvious, but I actually don't think it is as obvious as we think it is. What does it mean to respond? So I'm going to say that response is about modifying a utility function, right? There's some utility of the actions we take, and that is going to be, based on the utility to us of a future event times the probability of that, future event happening across all the future events. And that's, this is just classic definition of utility function. Nobody's, shocked here. And we have two ways of responding. And we're really used to, at least maybe not in this room, but in the general public, I think we're really used to doing a kind of response that I like to call preparing. And that is taking actions that mitigate the impact of a future event to allow us best benefit for that event. So that is, when I hear the weather forecast is going to rain, I bring my umbrella. Or if I think the stock market is going to go up, and I'm not such a big enough investor that I can manipulate the stock market, that I buy some stocks. Whereas intervening is taking actions to prevent or change the probability of that future event, right? And that's things like lockdowns or reducing carbon emissions or the like. And that matters when we think about evaluation, because when we think about preparing, pretty much we always care about the forecast. Right? We maybe for operational reasons, and some of the reasons I said about long-term and, conditional planning and just getting our head around it, we would like a scenario, but really it's the forecast because we just want to optimize this across everything, right? Then whereas, and I messed something up there, in the math, but we'll leave it. Whereas intervening, we can kind of think of it, what intervening is we're going to try to select the scenario. We're going to try to select these future conditions, and that is how we're going to optimize the future world, is by selecting what scenario we exist in the future, and that is what we're trying to optimize by intervening. And if we look at the people that we know have used the scenario modeling hub, and this is, I think, a challenge in evaluating any scenario modeling effort is we look at the people who've used the Scenario Modeling Hub over the years. We know they have very different things that they're trying to optimize. Their utility of the hub is very different. So ACIP, which for those of you who don't know, makes recommendations around vaccine use in the United States. Their decisions are totally centered around optimizing what scenario we are in the future, at least in terms of vaccine, right? They're totally trying to pick a scenario that we are in the future. I'm guessing here, but we know just because a random email I got once about like where the new hub projections, that the Hartford insurance company was using scenario modeling hub projections, and I have to think that they had no thought that they're controlling the course of the COVID pandemic, and that they're completely trying to optimize their utility under those future events. So you have different consumers, which creates challenges. And even more so, if we want to evaluate this for the future, we have to remember that the utility differs by consumer. Don't have a solution here. I'm just throwing these problems out here. But I will argue that even regardless of these complications in terms of who's consuming and who's optimizing what, that the full set of scenarios should be evaluated in the context of decision theory and value of information, particularly when we are talking about optimizing, through intervening. And that's just to say, right, like this classical idea, we have our set of models, it's coming in with other factors, it's informing the decision. That decision is going to have some cost that impacts utility. It's going to relate to some actual future state of the world, and that state of the world just in and of itself, regardless of our outcome, has some influence on utility. And then, lo and behold, something happens, and that presumably has some influence on utility as well. And we just want to compare that to the world where we don't have the decision. And I'd argue that, this is where we start really looping back to Emily's work, that wrong predictions of the counterfactual scenario can lead to wrong decisions. That, we want to know how well we're doing on this part of the item. That's not the whole kit and caboodle in evaluating our models and evaluating our sets of scenarios. But if we get this wrong, everything else, we're kind of done for everything else. Or it's hard to argue we're doing a good job on everything else. And this gets where we're going to link into what Emily was talking about, right? So if you remember, she had the scenario axis and, an outcome axis, in this case, cumulative hospitalizations. There were these two projections, and they were realized. And in fact, that's sort of translating into, in reality, the way for projections we get is like two scenario projections with an amount of projection uncertainty. Based on that projection uncertainty, things can seem very clear in which direction we go. But, what Emily was getting out, when we go and we actually figure out more and become able to estimate the error around those scenarios, there may be some overlap here. And if we translate that, if we assume there's like a linear translation to utility, I don't know why that font's so weird, but there's an area sort of overlap from the error that's a possible wrong decision. And that overlap might be a lot bigger than we think it is, because this doesn't include cost, right? And once we have cost, and presumably the thing that has higher utility in terms of the outcome is the more expensive thing. If it's not, why aren't we just doing it anyway? We may have an area of possible wrong decisions. So it's very important, I think, that we are able to go back and figure out actually what the distribution of error and what is under the idealized scenarios that we're using to make our decisions, even if we might not be able to achieve the outcomes that those scenarios are assuring we can achieve. And just a close here with just a few final thoughts. That being optimal isn't everything. I've talked about being, thoughts about like how we should think about being optimal, and often we can think about that, and we have a tendency to think about, okay, well, as long as we correctly order these utilities, like that's good enough, because we might be optimal in the type of framework that I'm talking there. But we have to remember that communication of this information is always an important part of the whole thing. So we might be ignored and lack face validity if our sort of projections of the future don't seem to be reasonable, even if the deltas make sense. And we also have to remember when people go back and argue, even prospectively, but definitely retrospectively, when they argue about stuff, they tend to focus on the cost of whatever we did rather than all this counterfactual comparison. So thoughts on what next, or what maybe I would like to work on some over the next few weeks that I have the pleasure of being here before. I think we need to think about what aspects of utility functions we need to know. That's came up in earlier conversations, and maybe come up with some sort of canonical ones that are for reference. I think it's worth working out the math on some of this for idealized situations where people are making the optimal decision based on the model scenarios, and we assume we know how good that decision would have been. Obviously do simulations and maths, and then directly tie this to value of information analyses with a focus on including the spaces scenarios. Okay, I didn't leave quite as much time for questions as I meant, but I did leave some. So
thank you very much. Any questions? Yeah, you were first.
Yeah, very nice talk. I think it was quite clear. And I was thinking, you included the cost at the end, as a term. But I was thinking, if you were to analyze it properly, it would be a probabilistic term as well, and so on. So it might be similar to the other. Maybe it's a silly point.
Yeah, I think there's a lot of layers. I agree. Whenever I start going down that rabbit hole of okay, how much do we affect, how much are we able to affect the actual scenario situation, and then and that's probabilistic, and then how much does it cost and stuff like that. I think, yeah, it gets there, and I think all of that is important to consider, but I also think there's some value in leaving those things a little fixed and trying to figure out the rest as well.
So my worry is with this approach, although it's written in this abstract way, for total probability to hold, like you've written it, the x1s need to partition the space. Okay, then to jump from that to wave 2 in the UK, which was the thing we got the most trouble for, because it's how big was wave 2 going to be? We all knew it was coming. Mm-hmm. And we had quite powerful politicians criticising us because they said, well, we got to 1,000 deaths a day, but some of the models were saying 2 or more thousand deaths a day. But that was under 2 lockdowns, and then there was the emergence of alpha, all these other things. And my worry is those X's don't capture either the bizarreness of UK government lockdown policy at different times, or the emergence of, say, alpha, which was made at that point a bit of a black swan.
Yeah, I mean, I think that's a challenge. I think that gets to one of the things that gets to our head on is the projections of the scenarios we have to have some sort of face validity, and they have to have sort of retrospective face validity, which is hard to do ahead of time, right? So, and then I think the policy, I think it gets at, right, kind of what everything Emily was showing was gonna, our actual policy or our actual way our policy impacts the thing we're trying to change is never going to be what we try. But at the same time, I think, once again, I feel like it's worth trying to figure out, get better at thinking. Because right now, I think of what we do is we kind of, at some point, get driven to treating this like a forecast and just deciding how well we did because of that. And that's not ultimately ever going to answer the question we want to answer. So.
Thank you. I know this could go on much longer, but I'm going to wrap it up there. Thank you very much, Justin.
Thank you.